So, Roberta, what are we doing here?
Bernie, thanks for asking. It's been a fantastic conference. We've had an amazing response with the Queensland Pavilion. So the idea started probably about 5 months ago, that we thought that it was quite expensive for one company to have presence here and to have a decent sized footprint. So we thought, well, what about it inviting all Queensland companies to show that we in Queensland is like a one-stop shop, and we can do everything from drug discovery and manufacturing all the way through preclinical with clinical trial sites through to marketing that product. And everybody took up the idea and ran with it too, and everybody thought it was such a great idea. The result was positive, and so consequently we've got all of these companies being a part of the Queensland Pavilion. Was sponsored largely by the Queensland government, and it's been fantastic. Not only have we met all of these people at ARCS, we've met our own colleagues as well. So
it's
now
been amazing. It's been phenomenal. It's been far, far better than ever expected.
Than what we were expecting. So now we know our colleagues from different areas of the clinical research profile, and we'll now be able to put people in touch with each other.
Marvellous. And thanks to ARCS, I guess, for really letting us do that. It's been amazing.
Yeah, no, they've been very open to the idea. So, Bernie Moris-Smith from the Sunshine Coast, what are you doing here?
Well, actually, Roberta, I actually work with you in Queensland Health. We actually are the Queensland Health Coordination, Clinical Trials Coordination Service. Actually, we've been presenting at this ARCS conference about teletrials. It's actually bringing clinical trials to the remote and regional regions of Australia. So we've been working for 12 months, writing SOPs, getting the good governance around how we'd actually take clinical trials to our remote patients. And we've had a fantastic year. It's been an amazing year. We've looked at all kinds of aspects of consent, of cybersecurity, all the processes involving our sponsors, our CROs, our sites and our patients.
And even thinking about how are we going to get drugs to our remote areas if there's a flood in that area. So the thinking hat has been running full time for the last 11 months.
It has, yeah.
We've had an enormous amount of fun. One of the reasons why we wanted to bring teletrials into Queensland was because 1/3 of our population is in the rural and remote area. Yeah. So if you think of that tiny little square down in the southeast, about 70% of our population is down there. But there's a whole expanse of Queensland.
And that's our new job that we've got going forwards now, is actually really mapping that region and finding out what facilities that we have in those remote regions and actually telling everybody else about what we have in Queensland. And that's our job, I reckon, for next year when we come back, is to share the experiences of what facilities and abilities we can do. We can do more. We can take this further.
We can do it all. Come to Queensland, where the Sunshine State and the atmosphere is great.